Everything you need to know about norovirus. According to CDCP, norovirus is a highly contagious virus that causes vomiting and diarrhea, and this virus is not related to flu and can infect and sicken anyone. During the winter, norovirus illnesses are more likely. The virus is named after Norwalk, Ohio, which experienced an outbreak in 1968. In the U.S., over half of all foodborne disease outbreaks. Children under the age of 5 are most affected. Nearly 50,000 deaths in developing countries. Norovirus infection can cause billions of norovirus particles to be excreted. And only a few virus particles are capable of infecting others. 1. Symptoms of the virus: nausea, vomiting, watery diarrhea, abdominal pain, and, in some cases, loss of taste are all symptoms of norovirus infection. After being exposed to norovirus, a person usually develops symptoms of gastroenteritis 12 to 48 hours later. Lethargy, weakness, muscle aches, headaches, and low-grade fevers are all possible symptoms. In most cases, the sickness is self-limiting, and serious illness is uncommon. Although norovirus is unpleasant, it is rarely harmful, and most people who catch it recover completely within 2 to 3 days. These infections can be symptomless or cause symptoms. 2. Important fact about norovirus. You can develop norovirus disease multiple times in your life. You may not be protected against other forms of norovirus if you have been infected with one. Immunity to, protection against, specific kinds can be developed. However, it is unknown how long immunity lasts. This could explain why norovirus epidemics infect so many people of all ages. Your genes also play a role in determining whether or not you are susceptible to norovirus illness. 3. Transmission of the virus. Noroviruses are spread directly from person to person, 62 to 84% of all outbreaks reported, and indirectly through contaminated water and food. Norovirus can be transferred for 2 weeks or more after you feel well, according to studies. They are exceedingly contagious, and an infection can be caused by as little as 20 virus particles. Norovirus-contaminated food or drinks, touches norovirus-contaminated surfaces and then put fingers in mouth, having direct contact with a norovirus-infected person, such as by caring for them or sharing food or eating utensils with them. 4. Real-world examples of norovirus. 126 people were seated at 6 tables in December 1998, and 1 woman vomited on the floor. People proceeded to eat as the staff swiftly cleaned up. 52 persons reported fever and nausea to vomit and diarrhea. More than 90% of those who sat at the same table as the sick woman afterward became unwell. At a nearby table, more than 70% of the diners became unwell. An outbreak of norovirus sickened more than 700 persons in Quebec, Canada, between March and August 2017. According to a CFEA Food Control Agency inquiry, the culprit was frozen raspberries imported from Harbin Jaitai Food Company Limited, a Chinese supplier, and Canadian officials issued a recall on Harbin Jaitai raspberries products. Norovirus has been in the spotlight as a result of the coronavirus pandemic, a highly contagious group of viruses. In 2021, roughly 154 norovirus cases have been documented so far in England. Norovirus causes 685 million cases of illness and 200,000 deaths per year over the world. 5. Prevention of the virus. Maintain good hand hygiene, safely handle and cook food. When you're sick, don't cook or look after others. Surfaces should be cleaned and disinfected. When attending a huge party, avoid consuming food. Thoroughly clean the laundry. The norovirus may survive outside of a human host for weeks, months, or even years, depending on the surface and temperature conditions. It can survive for weeks on hard and soft surfaces, and months, if not years, in polluted still water. The virus lingered on surfaces used for food preparation for 7 days following exposure, according to a 2006 study. 7. Treatment for the virus. No specific medication to treat norovirus infection. Norovirus is a virus, it cannot be treated with antibiotics. Antibiotics target bacteria rather than viruses. If you have a norovirus infection, drink plenty of fluids to replace the fluid lost during vomiting and diarrhea. This will aid in the prevention of dehydration. If your child has a norovirus infection, keep an eye out for signs of dehydration. Dehydrated children may cry seldom or not at all, and they may be particularly lethargic or cranky.